Well, from Harvard Eye Associates today, we have Dr. Brian Kim. Nice to see you again, sir.
Nice to see you. Thanks for having me back.
Yeah, it's always nice to have you folks on from Harvard Eye. You all do such great work over there, and
Thank you very much.
Everybody is so nice, and it's great to have you all on. And I love all the different things that you do over there, but more than everything else, when you guys come on, the caring that you show and all the different information that you bring us is fantastic. So we appreciate it. Today we're going to talk about something that affects a lot of people in this country, diabetes. And as we have heard for years and years and years, if it's something that is not controlled, it can eventually affect your eyesight, correct?
That's absolutely right. Yeah, diabetes is, it's hard to go a day without seeing or hearing about diabetes in the news or seeing something about it on TV. It's such a prevalent problem, and it's too complicated of a problem to really delve into it completely today, but I want to focus more on the eye component as you just noted. But yeah, it's a very common problem. About 1 in 10 people actually has diabetes, and about 20% of those people actually don't know that they have diabetes, making it very important for us as patients to really see our primary care doctor regularly, to be screened for that, because it sneaks up on you, and it's not something that causes very many symptoms oftentimes. So, and that's in general. So now, this is, unfortunately, diabetes is the leading cause of vision loss, and that's permanent, unfortunately, permanent vision loss in people in industrialized countries. So
wow,
very, very, significant if it's not taken care of.
So what is it that, we certainly know what diabetes is, and that the problem that your body isn't controlling your insulin level and things like that.
Sure, it's everybody sort of understands that diabetes is a problem of sugars, but we don't really understand, well, why is it sugars that's really linked to heart problems and strokes and nerve problems? It doesn't make sense. Well, the analogy I usually make is that sugars are crystals, and crystals are like shards of glass, and if you think of it like very sharp shards are flowing through your blood vessels, they can damage your blood vessels, and so it's actually a problem of blood vessels. So
interesting.
Where we see it the most is in the smallest blood vessels, in our capillaries, and the only place in the body that we can actually visualize these capillaries are in the eyes. So getting routine screenings, annual screenings, if you're a diabetic, is extremely important, because it's sort of a litmus test as to how well overall you're doing as far as controlling the sugars and controlling your diabetes. So now this is oftentimes the earliest place that it shows up too.
Interesting.
So, is in the eyes, and alarmingly 40 to 45% of people eventually develop some form of retinopathy or some kind of eye condition or due to diabetes. This is alarmingly high, especially when this can lead to progressive vision loss. The worst part of this, however, is that people don't really have symptoms. You don't notice that your vision's getting blurry necessarily, or you don't have any real symptoms oftentimes until it's too late. So when there's so much damage that we actually have to do a lot of things all at once. So the key to treating this problem in the eyes is to catch it early, control it early, treat early, and save your vision.
So to treat this, as far as your vision goes, is it the same type of treatment that a diabetic would take? In other words, the same kind of medication, or is there also something you would additionally do for the eye specifically?
That's a great question, and I get that quite frequently. The mainstay of the treatment for diabetic eye problems is really controlling the blood sugar.
Okay.
And oftentimes there's a number called the hemoglobin A1C, which is a blood test that's drawn by your primary care physician or your endocrinologist, and it gives us about a 3-month report card, as I like to call it, as to overall how well your sugars are controlled. So this avoids the day-to-day fluctuations in your sugars and just gives us an idea. And we want that, depending on other medical conditions, we want that to be around 7%.
Okay.
But that's usually the best indicator of control. Now, there are a few other things here, and these are other options that you'll have to talk to your primary care doctor about, but treatment of baby aspirin early on, like I said, mentioned controlling the blood sugars. Blood pressure has been implicated as far as a contributed to worsening problems, and oftentimes there are certain classes of medications, like an ACE inhibitor, like lisinopril or enalapril, or a similar class of medication that can oftentimes help with the retinopathy or the eye disease. We're seeing in the last bullet point here, the cholesterol. Yes, controlling cholesterol overall is important, but really this old medication, actually, it's called fenofibrate, we're starting to see actually can start to slow down the progression if we start it early enough. So, and that's a remarkable finding over the past couple of years.
So it sounds like one of the first steps is having your, where they draw blood and they go through the kind of different tests they always do. And that's one thing that they can do. But the other thing is, as you said, when you folks look at the eye, you may realize something quicker.
That's right.
Interesting.
We can oftentimes see it's problems in the eye that precede the diagnosis of diabetes. Fortunately, it's not a very common occurrence in this with the quality of healthcare that we have in the United States, but we still see it. And these manifestations in the eyes can be numerous, and it can be something where you just as simple as having recurrent eye infections, or if you have scratches, or you don't heal very well. Very, very subtle things that that may trigger or key us into the diagnosis of diabetes. The most important things I've put in the middle of the pack are the cataracts, which diabetes tends to accelerate cataracts, such that the lens inside the eye starts to harden and change shape, and it starts to blur your vision faster than it would on average. That can fortunately be taken care of with a surgery. But the more important things and the more serious conditions are glaucoma and retinopathy, and intraocular bleeding, so bleeding inside the eye. Those are things that are much more can be permanently devastating to your vision. So making early detection absolutely key here. So,
yeah, definitely. Here's some of the treatments for this, and talk about these, and at what stage can these still be effective?
Sure. So about a third of patients with diabetic retinopathy and have a center involving or a macular problem called diabetic macular edema. Now, this is not related to macular degeneration. This is something totally different. But we start to accumulate fluid in the macula, and that tends to blur our central vision. And if that's the case, the vision tends to decline fairly quickly. And when that happens, we can start to treat with certain medications that are given inside the eye as either injections or implants. And these medications help to really control not only the fluid and the leaking, but also progression of disease. So,
how often would the injections have to be done?
Depending on the type of medication, typically monthly to begin with, and we generally see how you respond. And everybody gets a really very tailored treatment regimen specific to their problems. So now the more interesting things and the cutting edge technology, so to speak, is the intraocular implants, and these are very slow release medications of steroids that we can implant a little pellet, which you can see it's very, very small here, and we can implant that. And we have one that lasts about 3 months, and we have a brand new one that was FDA approved earlier this year called Iluvien that lasts 3 years.
Wow.
So that can, going from monthly injections until once every 3 years.
I can see why monthly injections would be kind of scary for people.
Oh, absolutely.
When you think about that.
Absolutely.
But when the implant, that is wonderful news.
So it is very good news.
And then you also have a laser surgery.
Retinal laser, there are various types of retinal laser that we can do depending on the presentation and the characteristics of the retinopathy. But retinal laser, if caught early enough, can really help save vision significantly.
All right. Great information. And I think the key is what you're saying is just get checkups, whether for your eye, your blood tested, and obviously if diabetes runs in your family, you might want to look at that as well, especially is it type 1 diabetes? Is that the one you're more born with or more genetic than the type 2, am I right?
Type 2 tends to run in families.
Oh, type 2, okay.
Type 1 tends to be earlier onset,
Okay.
but that's not necessarily the case anymore. So,
Okay.
But yeah,
All right.
it's a blurred line.
All right, well, thank you very much. It's great to have you here
Great.
today.
Well, thanks so much for
And
having me.
have a great holiday, and we'll see you soon.
Thank you, you too.
And great information. So the key is, of course, get your checkups. Get your primary checkup, and definitely get your eyes checked. What would you recommend as far as coming in getting an eye exam? How many times should it be for the average person? Every year, every 2 or 3 years?
We recommend about annually.
Okay.
And if you're diabetic, at least annually, depending on
Okay.
certain findings in the exam. So.
All right, very good. Great to see you, and we'll be right back.